Hi, everybody. Today, I want to talk to you about the highs and the lows of progesterone. And I also want to discuss some naturopathic and some functional medicine approaches to healthy hormone balance. This is video 3 of my hormonal health series. If you missed any of those other videos, be sure to check out the link in the video description because it will have those links to previous videos within the link to more information and more details that go along with this video, the accompanying article for that. So make sure you check that out. Basically, what we've already gone over is the many ways that hormones regulate our whole body and their system-wide effects, and how if even one of those hormones is off of balance, it interacts and affects all of the other hormones and can cause psychological as well as physiological havoc throughout our whole system. One of the star key players that's gotten a lot of attention is progesterone. And progesterone was highlighted specifically because one of the most universal things that we are all going through at any point in time, and especially within the past few years, if you're watching this in 2023, is stress. And not just stress that is acute and lasts a short period of time and we rebound and become more resilient, but a lot of people have been under chronic, unrelenting stress. And just when one thing feels like it's lightening up, another thing kind of hits, whether it's personal or through world events, but especially through a combination. And what happens is when our body gets stressed, our hormones get affected. Specifically, we make more of this cortisol and less of these other hormones for reproductive fertility health, such as estrogen, progesterone, testosterone, and other hormones as well can be impacted. So first of all, I did do a video, the previous video on progesterone. I went over its main function, its biological structure. I went over its main roles in the body, which is most well known for fertility and reproduction, but it also has systemic effects for both biological men, biological women. And specifically, there's been links to breast health as well as prostate health, bone health, neurological health, mood, and various other aspects to progesterone that make it way more than just a fertility and pregnancy hormone. Though again, that plays a vital role in that. It is regulated on a three-way feedback mechanism loop. To keep things simple, there's a little bit more to that web, but basically there's a three-way signal where the ovaries and testes will produce the progesterone during puberty, and then as the body needs to regulate levels, it gets signals from the hypothalamus to the pituitary to the ovaries or the testes to release either progesterone or estrogen. So that is the basic summary. Okay, now we are in part 2 of the progesterone series. And in this part, I am going to go over what happens if progesterone becomes dysregulated, the symptoms of the high and low levels of progesterone, and what potentially might cause that, testing for progesterone, and so things to keep in mind in general when you're testing for any hormone, treatment with progesterone, and I'm going to look at some of the caveats with bioidentical hormones and conventional hormones, replacement therapy. Okay, and then the naturopathic and functional medicine approaches to optimize progesterone. Now, just so you know, this information was originally published on my Rupa Health post, but I've added some more fresh, new educational aspects to it. So be sure you check out both of those different website links for you so that you can become educated. But here is the main points. All right. As far as the highs and lows of progesterone, we know that ranges vary depending on biological sex, pregnancy, and the time of one menstrual cycle. So the second part of a woman's period is when the progesterone levels are going to be higher, and in pregnancy, levels can get up to 10 times higher. Men have less progesterone than women for the most part, except postmenopausal. And what you want to remember when you test hormones is the timing of the test, the method used. So I'll go over that in a minute, but basically urine, saliva, or serum, or serum is blood, and then interfering factors. So for accuracy, whenever you're testing hormones, you want to test your hormones at the same time of day, as well as if you're cycling women, specifically the same time of month. And you want to use the same method that you used before. There's correlations, but they're not perfect between blood, saliva, and urine. So you want to use the same method if you're seeing how a different approach or different intervention is working. And again, we'll go through that a little bit more later on. But you and your doctor should also consider some of the interfering factors that can impact progesterone. So we talked about stress previously, other things such as if you fasted or didn't fast, or if you're intermittent fasting, how that can impact things such as thyroid or other hormones levels. Blood sugar can definitely impact hormones. If someone's been exercising, especially over exercising, that'll impact hormones. So these things will all impact levels. So if all things are considered and you're getting full assessment and a baseline, and you notice your progesterone levels are consistently higher or low, there's probably an underlying issue that needs to be addressed for optimal health and especially for fertility. So let's go over some of those aspects. So if someone is getting high progesterone levels, that can indicate most obviously pregnancy. It can also indicate some other disorders that are rarer but can be found with high progesterone levels, such as ovarian cysts, a disorder in the adrenal glands, ovarian cancer, and then just excessive levels of stress. Usually more acutely, the progesterone will go up. So symptoms of higher progesterone are associated with lower sex drive and some emotional eating and craving. If a woman is cycling, usually symptoms will be more present during a specific time of the month. Now, the pathologies that I mentioned, such as ovarian cysts and cancer, could also be causing high progesterone. This is more rare, but this can be confirmed through imaging and additional testing. So ovarian cysts, which are that can be related to polycystic ovarian syndrome, those symptoms can include pressure or fullness in the abdomen, bloating, and pelvic pain. And of course, there's other symptoms as well. Ovarian cancer can have similar symptoms as well as urinary frequency and appetite changes. So most likely if someone has consistent high progesterone levels, those things are going to be ruled out first. And then you're going to be looking at some other aspects such as, is stress impacting it, or what is causing this high progesterone? And then more commonly, you're going to see some lower levels of progesterone. And this can indicate ectopic pregnancy, where the egg is fertilized outside of the uterus, usually somewhere within like the fallopian tube or in the reproductive tract. So that can cause progesterone levels to get lower. Miscarriage is when the loss of a baby, irregular periods, or absence of menstruation or amenorrhea. Those are indicated for lower levels of progesterone. And what could cause that? It's usually related to fertility or reproductive causes when we're looking at lower levels of progesterone for women, for the most part. But things such as uterine bleeding abnormalities, menstrual cycle irregularity, or missed periods. And there's various factors for that can be related to a woman's diet, usually not eating enough or excessive exercising, or a combination of that, as well as just some hormonal genetic issues or lifestyle factors. There can be blood spotting and pain during pregnancy. That can be a symptom. Miscarriages are obviously a symptom. Early labor, that means there's not enough progesterone to signal full term for a woman. PCOS, those polycystic ovarian syndromes, that can be related to lower progesterone as well. Symptoms of high estrogen, such as lower sex drive, weight changes, and gallbladder issues, those can be, if estrogen is too high, progesterone might be low in comparison. Mood fluctuations, progesterone tends to be calming. It hits the GABA receptors, which are a calming neurotransmitter. One of the metabolites does. And then worsening of menstrual-related disorders such as premenopausal syndrome or premenopausal dysphoric disorder, especially in mood. Those can be really some signs of low progesterone. So if we look at all the various causes and all of the various symptoms, we can kind of see with our body where it might be off. And a lot of times there'll be treatment discussed for that. And progesterone is indicated for treatment conventionally. A woman will be recommended this if there is absent periods, if there's infertility, if there's endometriosis, which is a condition in which the uterine tissue is outside of the uterus, fibrocystic breasts, premenopausal syndrome, support during the luteal phase, which is the second phase of a menstrual cycle where the progesterone is higher. That is usually during IVF or in vitro fertilization for pregnancy. They will give progesterone there, prevention of pregnancy loss. So again, remember one of the signs of low progesterone is miscarriage. And again, so if a woman has a history of miscarriages, they might be giving her progesterone. And then to protect the endometrium, which is the uterine lining, during hormone replacement therapy with estrogen. So I just want to talk a little bit here about bioidentical hormone replacement therapy, or BHRT, because it's just easier to say, or hormone replacement therapy, or HT. So micronized progesterone is actually a form of BHRT, and it has been shown in some studies to be better tolerated with less side effects than synthetic forms of hormone replacement therapy for progesterones. But BHRT use is controversial among various hormonal experts. And a lot of times integrative medicine doctors will prefer and tend to view BHRT as a natural and safer alternative to conventional hormone replacement therapy. Conventional doctors will likely disagree. Both of them argue, and both of them have studies on both sides of the equation supporting both of their arguments. But I will say, looking at the literature, it does appear most of the side effects and serious risks that can occur with either form of hormone replacement therapy, because you're putting exogenous, powerful, potent, easily swayed molecules into your system that can very easily become dysregulated. A lot of times what's happening with that is they're improperly prescribed dosages of estrogens, and especially synthetic progesterones tend to have higher side effects than progesterone of BHRT. Now, some of the risks and why this needs to be taken seriously include blood clots, breast cancer, and stroke. So it is imperative that if you're getting any form of exogenous hormones, that they are personalized and monitored by an expert physician. Don't just go rubbing progesterone all over your body. Long term, that can cause some blood sugar issues later on, or some other hormonal issues if it isn't monitored and done correctly. Okay, so make sure you know what you're doing, and also know that when used appropriately for the right woman or for the right even man, if indicated, it can be very safe and very effective. But again, there's caveats to that. So one of the caveats is monitoring and testing progesterone levels. A lot of times people want to get a baseline test to examine the hormonal levels, and then also look at how the levels shift with BHRT or HT. Now, this will help personalize what someone needs specifically. Now, there's different forms of testing, which I alluded to before. So you have the urinary test, you have the saliva test, and the serum test. And I said them in reverse order of probably what people are most familiar with. But serum tests in the blood are the most often used, and they actually don't measure free hormones. They measure more bound hormones in the body. And they give a baseline of how much hormone is available if all goes well, and your body's able to break it down and use it when it's supposed to use it. Salivary tests measure free hormones and more of the tissue levels. Those are really good for monitoring topical applications. And then urinary metabolite testing is used to determine how someone's metabolizing hormones. So, for example, someone might have more estrogenic activity or more inflammatory estrogens, or they might be metabolizing cortisol very quickly. So their cortisol levels appear low, but they're actually producing a lot of it. Sometimes when practitioners can't figure out what's going on, or they just want to make sure that when they're giving hormones, the person is metabolizing them down a pathway that is less inflammatory, they're going to do urinary testing with some of the salivary and serum testing, depending on your type of hormone use, whether it's going to be injection, whether it's going to be oral, whether it's going to be topical, whether it's going to be a combination. A practitioner will choose what test to use, and also based on their experience, preference, and what they're comfortable with. The bottom line is you want to at least monitor it somehow, and usually please try to monitor it with what it actually can measure. So again, if you're doing topical, you're going to want to ask your doctor about saliva. A combination of them can be helpful, like I said. So you're looking at how much hormone is available in the serum, what's getting to the tissues, and what's being metabolized. So I do have links in my Rupa article to specific tests and brands that you can check out and run, if you're a doctor, look at too. So those are the important things. If we're thinking about highs and lows of progesterone, a lot of times the first thing someone will go to is, okay, let's replace it if it's low, because that's more common. But what we want to look at is, why did it get low? And that's where naturopathic and functional medicine come in, because they're going to focus more on lifestyle, behavioral, and foundational support, and use least invasive and lowest risk interventions first. So this way the body comes into balance naturally. It's at its optimal level of balance, and we know what the body's capable as far as a baseline level of hormone production. So rather than just piling on hormones and then somebody's different triggers are erratic and the hormones bouncing up and down and constantly having to adjust hormone levels, if we get that baseline dialed in, those hormones, if needed, even after all of this, will be more effective and better utilized by the body. So some of the things we look at as a naturopathic and functional medicine doctor are stress, because that affects cortisol, which affects progesterone, which affects all the other hormones. Things like I went over in a previous video: meditating, exercising, breathing techniques, journaling, essential oils, especially. These can help reduce stress levels. Making sure something as simple as making sure they're prioritizing sleep, or helping them find out why they're not getting sleep. Most people need about 7 to 8 hours or 7 to 9 hours. And sleep actually helps regulate your hormones, and especially your blood sugar, which affects your hormone levels as well. The right amount of exercise, so moderate, enjoyable levels of exercise, can decrease stress. It has so much benefits for your brain and body. If someone's excessively exercising or over exercising, it's going to boost cortisol, lower fertility hormones, and interfere with their menstrual, especially women will see it with their menstrual cycle. So excessive and intensive exercise, if someone is looking at the fertility and progesterone levels, if that's occurring, we want to address more balanced approaches to exercise, just to help their body be under less stress. If someone's completely stressed at work with world events, taking care of children, plus their aging parents, plus, in 10,000 different directions, and waking up at 4 a.m. to do HIIT training every day and intermittent fasting, like that's not a good formula for stress relief on the physical body. All of those things, the little things, like maybe, the exercise with someone who's already balanced and giving them that hormetic stressor or that balancing stressor to build resilience, could be good in other circumstances. But again, I think a lot of us are on overload right now. So we want to do moderate exercise. There's a little soapbox there. Nutrition is also important. And when I say nutrition, remember, we think of nourishing our body, making sure that we're getting enough nutrients to make hormones. a lot of the issues I see with my women in my practice is they're not eating enough, and they're substituting nourishing foods that they like for quick foods that maybe they're craving because they're not balancing and nourishing their brain and bodies. And this can be done in a non-diet way, right? I don't focus on getting people to a specific weight. I focus on what's best for their health and their mental state, health at every size. And one of the things that does interfere is if people are eating foods with chemicals in them, with synthetic growth factors, specifically antibiotics and pesticides, those do interfere with hormones. So if someone can afford it and it's accessible, eating as much organic as possible, as well as eating whole foods or even the clean 15 with less pesticides, anything to decrease that body burden that could impact sway those hormones, those delicate, powerful signals is helpful. And then if someone eats a diet with things such as high levels of vitamin 6, B6, zinc, iron for some women, these can help support progesterone levels because they play a role as cofactors in hormonal regulation as well as removal by the liver. One of my favorite herbs for progesterone is actually chasteberry, or known as Vitex agnus cactus. And it has some evidence for increasing progesterone and prolactin levels and decreasing estrogen at low dosages. Now, high doses are going to have the opposite effect. So you want to get the just right Goldilocks dose. Now, this botanical is said to inhibit the signaling molecule of follicle stimulating hormone. So remember, that's your estrogen signal, and stimulate the release of luteinizing hormone, which is going to raise progesterone. And then that favors this more progesterone in the body. So these are some of the things that can be utilized as a low intervention first to get the baseline level. So we're looking at stress, looking at sleep, we're looking at nourishing the body, we're looking at movement, and then maybe someone might need an herbal. At that point, if things aren't balanced, you might start testing hormones. I also use essential oils for, cooling down that cortisol to help the progesterone levels. And at that point, then I might be suggesting, I rarely need to, but looking at hormonal supplementation with additional support with their practitioners. So we have gone through a lot in the past several videos. We know that progesterone is a vital hormone for fertility, reproduction, but it also has essential systematic effects in women and men. And we want to know more about this hormone because it can help us assess when things might be off and some of the symptoms to look for. And I'm also hoping that you will see, by learning more about testing, the caveats, and what to consider as far as when you want to just come on in and kind of hammer those hormone levels with an exogenous source versus looking at some of these naturopathic and functional medicine baseline foundational support, how that can empower you to use more natural methods first to help kind of balance out the body, to also need the lowest dose with less side effects and also get the best effects if you do need to bring in exogenous hormones. So I hope that educating you on progesterone has been giving you some empowering information. I thank you for your interest in this topic. I am going to be continuing to talk about hormones, continuing to talk about mind, body, mental health, digestive health, some of my favorite things on this channel. So make sure you subscribe so you don't miss anything, and make sure you share the information. If you want to learn more from me through some of my courses, whether you're a professional or whether you are a consumer, make sure you check out the resources and the resource link in the video description. And just to remind you again, all the information, the research, all the science can be found in the accompanying article in that video description as well. I want to again thank you for your time and send you my best. And until next time, I will see you soon.